We're going to talk about benzodiazepine overdose, and this should be a review for most people, to be honest with you. We use benzodiazepines in EMS every single day. As a review, benzodiazepines, the Valiums, the Ativans, the Versed, the Xanax, can be used as sedatives, can be used as anticonvulsants, procedural sedation, so lots of different uses of benzodiazepines. And I'm going to give you a little bit of a review on how benzodiazepines work and then what to look for in an overdose. But benzos basically work through an enhancement of the GABA receptors. The GABA receptors are sort of inhibitory receptors, and the benzos work by sort of recruiting and enhancing the GABA receptors. Once these GABA receptors are enhanced, it basically leads to decreased firing of these neurons, and the decreased firing of these neurons lead to multiple different clinical findings that we usually see with benzo use and overdose: respiratory depression, decreased responsiveness, slurred speech, hypotension, difficulty walking or ataxia, dizziness. Those are the things you see with chronic benzo use as well as benzo overdose. So the treatment of benzodiazepine overdose, though, is really supportive. Maintain the respiratory status, make sure they're breathing. If you need to intubate them, you certainly may need to do that, and supporting their blood pressure, IV fluids, IV fluids, IV fluids. Now, there is a reversal agent, and many people have asked me about that over the years, of why don't we carry the flumazenil or romazicon in the field? Because that does reverse an overdose, hopefully, of benzodiazepines. And that's always an interesting question of why don't we carry that? Well, the reason we don't carry that is that we can actually cause harm to the patient with the romazicon. As I mentioned earlier, the benzodiazepines basically enhance the GABA receptors. So if you've got somebody that is on chronic benzodiazepine use, then they've got a lot of GABA receptors that are enhanced and not firing. And then if you give somebody the romazicon and it basically blocks those GABA receptors, and all of a sudden those GABA receptors start to fire, you can actually cause a seizure. So that's the main reason. Somebody that's on chronic benzodiazepine use and you give them romazicon, you can actually cause a seizure. So really and truly, to be honest with you, romazicon has no use in the EMS field, to be honest with you. About the only time people really should get romazicon is to reverse procedural sedation in those patients that are becoming hypotensive or having respiratory depression. And even some people will tell you that even in those cases, if they're on chronic benzodiazepine use at home and then you give them some Versed for a procedure, even if they become hypotensive and a decreased respiratory function, you still should not give them romazicon in that situation because they're on chronic benzodiazepine, chronic benzodiazepine use. So that's the reason that we do not treat benzodiazepine overdoses in the field with flumazenil or romazicon. So if you really think about it, it makes sense. We don't want to cause a seizure, and if we sort of unmask these GABA receptors, then we can certainly cause a seizure.